I'll be helping, advising, and sort of troubleshooting and assisting with logistics for the case competition. So I hope to meet a lot of you that way. And a little bit about me. So I'm trained in both internal medicine and pediatrics, and I've been at UCLA for about a year and a half now. I graduated about a decade ago and kind of moved around the country until I came back home. And my international work is mostly in Haiti and sub-Saharan Africa. And I also work with an international NGO named Alima, which works mostly in West Africa, maternal and child health. And back here more locally, I'm involved in asylum work and immigrant rights. And that's something I feel pretty passionate about. So with that, I would like to introduce our dynamic, or I don't know, they're not a duo, they're actually a trio, our dynamic trio of student leaders who are gonna really be sort of integral in this case competition. So Tucker Avra, Alexandra Kier, and Anwesha Dubé. And so they'll be just going through the logistics of this case competition for the next little bit, and then we're going to break out into some sort of breakout sessions.
All right, thank you so much, Dr. Ellis and Dr. Gallup, for joining us this evening and starting us off with this introduction. Hello, everyone. Thank you for joining us in the middle of your week. Welcome to our information night and mixer. We've been working really hard behind the scenes to put this case competition together for y'all. So we're really excited to be sharing this with all of you. As mentioned, my name is Anwesha, and I have two incredible co-directors with me, Alex and Tucker, and we're excited to start off this night. Please feel free to turn on your webcams. We would love to see your bright, shiny faces, exhausted at 6 p.m., but still happy to be here faces. And of course, if you're comfortable, only if you're comfortable. You don't have to, but please do. It'd be nice to see them. Let's get started then. Okay, let's advance the slide, perhaps. Maybe not. Magic happening there. All right, okay, cool. So quick rundown of what to expect this evening. We'll start off with why you should participate in a case competition, as well as more about exactly what a case competition is in this introduction section. It'll focus on exactly what a global health case competition is, very specific, and we'll present a case example to you guys as well. From there, we'll give y'all more logistical information about what to expect from our own case competition, as well as registration details. After that, we'll go into a question and answer session. We'll open up the floor to you guys for any questions that you might have. We like to think we have some answers. And from there, we'll go on to the mixer portion of the night, and that should be fun. We've got some exciting icebreaker questions for y'all. And then finally, we'll end with some helpful links to aid y'all along this competition and keep you updated on everything that's going on. Now moving onwards, perhaps. Okay, there we go. Oh, there we are. All right, before we begin, we have to give a huge thank you to a number of leadership at all of these institutions. We really owe them a huge debt of gratitude for helping us spread the word about this competition, connecting with all of you. And we specifically also want to thank Tess and Kelly from Anderson, because they met with us early on and gave us such great feedback to really plan this competition, make sure everything is beautiful for you guys. So thank you guys so much for all of the help that you've given us. And now we can begin with a little bit about really what our mission was as we started to think about this competition and structure it. And that's basically to facilitate student networking, mentorship, and real world problem solving opportunities through collaboration in multidisciplinary teams that will develop innovative solutions to complex global health issues. So this mission is basically threefold, and why we really feel that you should participate. Essentially, we want to make sure that we're providing y'all with a means of stepping outside of your own respective fields and broadening your view about all the factors that are at play in global health, because there's just so much going on. It's not just health and medicine, there's policy, laws to respect, technology to be developed. So it's extremely comprehensive. So that's one aspect. Another is that we wanted to give you all an opportunity to connect with just incredible experts in the field. Learn from them, ask them all of the questions that you ever wanted to ask, and maybe even start building a long-lasting relationship with them. Next, we want to give you guys a chance to learn about global health issues. It's kind of nerdy, but acquiring knowledge is really great, and applying and all of that is such a great way to just build upon yourself as an individual. So I guess at the heart of this whole competition is we wanted to provide you guys with like a safe space to really grow both professionally and personally. And then finally, the winners of this case competition will go on to compete at the International Emory Global Health Case Competition, which has a measly cash prize of $6,000. And let's be real, we can all use a little bit of love in our bank account. So that's a nice little thing to look forward to. Also going forward, this case competition is, we moved forward too much. We're going back one slide. Okay, so it's a really great experience for you guys, and it's going to impact your lives beyond just this competition, beyond your time at UCLA, and it should really be a great way for you to hone in on your interdisciplinary and cross-professional skills, as well as synthesize information, team build, problem solve. I'm going to go back one slide. We seem to have moved forward a little bit too early. But essentially, like, this is we tried to model all of our case competitions around well-known, we're having technical difficulties. We tried to model this competition around just well-known case competitions around the country, those that have, been tried and tested throughout time, across time, and in every little testimonial that we saw, everyone basically talked about how it's been a great way for them to assess their own skills when working on a team. They've mentioned it in job interviews about how they were able to actually navigate a problem and come up with a solution, which is such an important skill to have, troubleshoot. So we're really excited to be giving this to you guys as an opportunity, and we hope you make full use of it. All right, Alex is going to take over from here.
Hi everyone, I'm Alex. I'm also a first-year student at the School of Medicine. Prior to coming to UCLA, I actually did my master's in global health, and case competitions formed a real crux of how we analyze complex problems in global health. So the goal of this case competition, and what exactly is a case competition, we know there are varying levels of familiarity. It's a 10 to 20 page document. The case will be that presents a complex global health challenge that's either ongoing or an acute problem. Past examples that Emory has presented, both at intramural and international competitions, include addressing electronic nicotine delivery, creating a palliative care healthcare system in Southeast Asia, and also sanitation solutions. So these are all multi-pronged problems that do not just address the kind of health medicine aspect. They are much more involved in the policy, business, and decision-making side, indicating the kind of intersectionality and interdisciplinary nature of global health. So for the competition itself, the goal is to create multidisciplinary teams. As you maybe have clicked around and seen who some of the participants are, we're representing across all of schools at UCLA in order to create a proposed solution to these challenges, and recognizing that no single sector is able to solely identify and provide a solution to these problems. So really what we want to emphasize is that there's not a right answer to any of these cases, and the goal of this is to be creative and work with a team to develop engineering, technology, management, law and policy reform, and business, as well as healthcare systems reform, in thinking about all of these problems. Next slide, if possible. Great. So we wanted to provide some of the feedback we got is to walk through a kind of sample case of what this looks like in the global health space. So I wanted to present the case that Emory did last year for their international case competition in 2020, which focused on a policy analysis and effective initiatives for the eradication of measles, which was set in the year 2030 during an outbreak in several different countries. Teams each took on a different country of this list with different varying levels of resources and different constraints around geography. What the case includes then is a background on this kind of made up measles case outbreak, as well as what the capacity for current surveillance is in all of these countries. There's also a specific budget allocated for each country, which correlates to the constraints that the countries have. We also will provide the medical background of whatever is necessary to know. So something we do want to highlight, all of us speaking to you from the medical school, this is not solely for medical students. In fact, like the medical information is provided and only can strengthen if there's a clinical aspect of response. It provides information as well on the drivers of measles outbreaks. We really are creating just the foundation, and it's up to you of how you choose to use this information and this information about population health, vaccination status, and what the current healthcare infrastructure is in order to kind of take this on. One other component that's later on in the case competition will be the case twist. In the case of this specific example that I'm walking through, the case twist was the application of this measles outbreak specifically to maternal and child healthcare and how it would impact babies that were born in the next 5 years. Next slide whenever we're ready, but I think I'm handing it off to Tucker now. But if there are any other, we're going to walk through questions later, but if there are any other questions about what a case looks like, please, I'm happy to answer them.
Perfect. Thank you, Alex. Thanks so much to both of you. My name's Tucker. I'm also a first-year medical student, part of this team. I'm just going to go through a little bit of logistics of signing up and what the case competition kind of registration, what the days are going to be. So the case is going to be released on January 23rd. So there won't be any work up to that point, except for team development and such, but on the case itself. Then the team will have 2 weeks to prepare. And then we're going to offer 2 advising sessions with faculty. So we're finding faculty right now. We're working with different faculty to set those up, and that'll be presented later, but it'll be faculty from a lot of different schools that you'll have the choice to set up with. And those will be 30-minute advising sessions, excuse me. The winning team, like was mentioned before, but really important, is going to represent UCLA in the International Emory Global Health Case Competition. And that's going to be March 20th through 21st of next year. Obviously, with the way that things are in the world right now, it will be virtual this year. In the future, we'll actually send the team to Atlanta to represent us. And so all the costs will be supported by UCLA. The way the case competition is actually going to go, and Alex touched on this briefly, but on Friday, February 5th, so 2 weeks after we present the case, the teams will submit a 10-minute video accompanied by a 1-page executive summary with their case solutions. From there, the judges will review those that Friday evening, and then teams with the highest first round scores will be announced on the morning of Saturday, February 6th. So the next morning, the number of advancing teams is going to depend on the exact number of teams that register. So we're going to figure that out as we get there. But they will be presented a case twist, just like Alex recommended, or just like Alex talks about in the last one. And then they will have that morning and the better part of a day to kind of come up with another 10-minute live presentation. That will be presented to judges at that times. And then they'll have 5 minutes of Q&A. And then the winner will be announced that evening. You can go on. Perfect. So registration opens tomorrow. Either individuals or teams can register. So part of tonight is the information night, and then the second section is a mixer. And that way you have a little bit of an opportunity to meet with some students from different schools. Probably the most important thing about this is that the teams must comprise students from 3 different UCLA schools. And so like an example would be a student from Anderson, a student from Fielding, and an undergrad student. If you register as a team, you don't have to have all 4 to 6 members. If you have like a friend or 2 friends that you want to register with as 3 people, we can match you with 2 to 3 other people. So that's a possibility as well. You can also register as an individual. Any questions when it comes, like once registration opens, any questions, we're going to have links at the end to email us, and we can help with whatever. So if there's any barriers to registering, just let us know and we'll help you get through it. Probably the most important thing of the evening, and it kind of goes without saying, but we want to make sure to mention it. All members of the team must be available to present on February 6th, which is our case competition. And then since we're sending this school, our students to the Emory competition, you must also be available on March 20th through 21st. So just make 100% sure before you register. that's an option. So I'm going to take any questions now. I'm going to field them, and then if I don't know the answer, I will send them to another one of my team. If you don't feel comfortable asking questions in person, you can send them to me via the chat or to any of us. And then also, if you don't think of a question now, like I mentioned, you can email us later. But any questions now, we're going to take until 6:30 to answer questions, and then we'll go into the breakout rooms. During the opportunity, yeah, so I'll answer the first. There's a lot of questions. Wonderful. During the opportunity to set up 2 faculty advising sessions, would we be able to seek additional advising from other sources, such as past professors? Yeah, the answer is yes. You can use all resources. Tracy, if you want to mention this a little bit, I know you know those rules, but yeah, so if you want to just touch on that.
Yeah, so you know, the way you approach the case competition is you do research in any way that you can. You want to get information, you want to have real world information as if you were trying to solve a problem in the real world. And if you have a job and you don't have the answer to something and you know somebody who does, of course you would reach out to them. So that's perfectly acceptable.
Okay, fabulous. Can you confirm that all presentations will be virtual? Absolutely. Our presentation will be virtual. The Emory case competition will be virtual as well. Like I mentioned, on the Friday night, you'll send in an executive, a summary of your case as well as a video. But then the presentations themselves for the teams that move on will be virtual. Will the PowerPoint be emailed? For tonight's PowerPoint, yes, we're going to send the PowerPoint out as well as make the recording available. Oh, perfect. Thanks, Alex. Will there be an opportunity for the judges to ask teams questions, or will the scoring be made solely on the video and one-page paper submitted? Yeah, so for the first round, that's a great question. Thanks, Joy. For the first round, there will not be any opportunities for the judges to ask the students questions. Your video presentation and your summary is your final answer, so to speak. And then in the final round, when you get the case twist and you have the live presentation, then there will be judges, a Q&A with the judges, but not for the first round. These are great questions. Please keep them coming. We know it's a lot, especially like we did the survey at the beginning. Not many students have heard of case competitions before. It's an awesome opportunity, and it's a big commitment as well. So please ask any questions.
While students are thinking of other questions to ask, Dr. Hoffman has joined the call, and I just want to give her the chance to introduce herself to everyone that's here.
Yeah, thanks so much. It's really exciting to see so many people on this mixer and interested. I'm the director of the Global Health Program in the medical school. I'm an infectious diseases clinician and researcher. I've spent most of my career focused in Malawi and Africa, and I just think this is a wonderful opportunity to meet other students, and for us as a medical school, often siloed on the South Campus, to really reach out and develop community with all of you that are not here on the South Campus, and also perhaps tighter community with those of you who are on South Campus in public health or dentistry or nursing. We're just really excited to be bridging communities. And in my work, I work with social scientists, I work with economists, I work with policy experts, and this is the real world. This is really how global health is at its best, is when we combine our expertise. And so I'm really excited about this opportunity for what it can, sort of help in all of us to inspire and promote best practices, which is working in teams to solve problems. So really thrilled to see the interest and excited to support this process.
Thank you so much, Dr. Hoffman. If there's no more questions, then Alex, if you want to take over, or Alex or Anwish, if you want to take over, and then we can move to the breakout rooms.
Can I ask a question? Sorry. For the video, is there a certain format that's expected? Like, are we expected to answer the question by showing our faces? Are you supposed to use like visual effects? Like, what's kind of expected?
Yeah, that's a fabulous question that I didn't touch on. So as we develop this, since this is the first year that all of the schools are going virtual, it's new for our school as well as all the other schools. And that's kind of in the works right now. So hopefully, we'll be sending out some more information. We're hoping early January. And obviously we want to have that before you have to make your final decision to be part of it. So yeah, we should have more answers on that. But at this point in time, we don't have that. But thank you for asking.
Yeah, I just wanted to chime in on that and say that we want you guys to be well prepared and successful because we want you to represent UCLA beyond. So we're going to do everything we can to make you prepared and comfortable before you actually compete.
I have a question.
Yeah, absolutely.
So I know there are different topics such as like chronic diseases, maternal health, health policy, but do teams get to choose a topic and you're given a topic to work on within that category, or a topic is like can be any of the categories?
That's a really good question. Alex, do you want to touch on that?
Sure, I can try. So it really depends on the case, how kind of broad or narrow the topic will be given to you. And the example I walked through in terms of measles eradication, you could apply that to a whole variety of sectors. And then it wasn't until that case twist that it introduced a very specific population. Online, Emory, as well as all of the other schools that do case competitions in this, which includes the University of Minnesota, as well as USC has a big competition in this. They all have previous cases. If you're looking for kind of examples, some are more broad than others. But really, be creative that you can apply it, and something that takes a horizontal approach and is more applicable across the board is probably a stronger kind of idea to have. But there may be some constraints within whether it's a specific maternal child related project or whether it's something infectious disease related.
Got it.
Because you guys are, oh, sorry. Is there more to your question?
Oh no.
Okay,
please
I was just gonna say, because you guys are gonna have at least 3 different UCLA schools represented, there's a lot of room to just really look into each of the different fields as well and try to come up with solutions from that. So again, like Alex said, it's as specific as you want it to be and as broad as you want it to be.
Thank you.
Okay, so we have a question in the chat too about the amount of time that it takes to prepare. And so you have 2 weeks. So hopefully that will make the burden a little bit less, not as compact. And that's why we did that. Some people do just 1 week for the case competition, but we decided for this first one to give you 2. But we want you to know that it's going to be a lot of work. I can't give you an exact amount of time because that depends on how much research you do, how conscientious you are, the team dynamic. But this is not something to be taken lightly. And we want you to do it, so I don't want you to be discouraged. But this is you're finding kind of realistic, real world, creative solutions to global health problems, and that takes time. So it's not as specific as you probably need, but that's pretty much what I could say on it for now. I don't know if anyone else wants to chime in there.
I was just going to say, and like with any experience, you're going to get out as much as you put in, right? So if you go out of your way to make those relationships with other professors and other experts, that's just going to be good for you in the end. And it'll inform what you end up presenting as well. So it's the result is going to be how much you put into it.
Thank you, Anwish and Tracy. And then the last question that we currently have is, will there be ongoing communication within the 2 weeks of the case competition, as in through a Slack or drop-in info sessions? At the current time, we don't have anything planned like that. We would love your feedback. If you'd like another drop-in info session, then we would be happy to have that. I know that the 3 of us, as well as our faculty leaders, are all available for any type of question via email. And so I think currently that's our plan. And then also those 2 faculty advising sessions, which is obviously different than logistics, but they'll be able to guide you a lot along the way as well. Is there anything else? So we're at 6:30, which we want to give everyone plenty of time to jump into the rooms. If you come up with any questions during your breakout rooms, then we're going to stay on for a little bit after the 3. So we're going to have 3 breakout rooms for 10 minutes each. Anwisha is going to mention that very briefly, but we're going to stay on after. And so if you have any questions, come on after. If you don't want to do that, or if you don't have time, then just send us an email and we'll get back to you. Okay. Thank you so much to everybody for joining us tonight. We are super, super excited about this case competition.
And there was a question about if you guys would be getting any communication within those 2 weeks. We're going to try to stay as we're going to try to keep you guys updated as much as possible on the Facebook page. So be sure to like that, and you'll also get some emails from us as well. So just look out for those things if you guys end up joining the competition. I think if nobody has any more questions, we could move on to the next part of our night, which is the mixer, the fun part, the exciting part. As Tucker mentioned earlier, there have to be at least 3 different UCLA schools represented. So this is going to give you guys a chance to really get to know people, find out people that you vibe with, that bring some sort of a new or interesting perspective on global health that you want to learn from and could elevate your group. And note though that the undergraduate only counts as one school. So just as you're flitting around, mingling, just make sure you're talking to a bunch of different people. And before we jump into those breakout rooms, please be sure to rename yourself with your actual name and then also which school you're from. So if you're undergrad, don't put like college of whatever, just say undergrad, because that makes it easier. The way that this will basically work out is that we have 3 different breakout sessions that are for 10 minutes each, and all of y'all will be randomly divided into different groups for each of the sessions. So session 1, you will be with a certain group. Session 2, you will be with another group entirely. We also have a question guide for y'all to facilitate the discussion. You'll basically start out by introducing yourselves. Actually, we can maybe share that document. Essentially, you're going to be introducing yourselves, and then there is a question that is associated with each of the breakout rooms. So once you're done introducing yourselves, ask that question, answer the question, and get to know one another. And of course, if you guys find yourself on a tangent or are just enjoying like another conversation entirely, like you guys do you, this is a choose your own adventure type of deal. So just talk to each other, have fun. You don't have to answer all of the questions, just they're there if there are any awkward silences or something and you want to fill it, because who likes those? But yeah, other than that, I think that's everything that we have. Also, afterwards, we'll be sending out a Google Sheet for everyone to contact the people that you really, really like. If you're not comfortable with everyone having your information, message us directly and we'll figure it out together. By us, I mean Alex, me, or Tucker. And yeah, a couple of us will be bumping through the different groups to make sure everyone's having a good time. And with that, I think we're good to go. Did I miss anything, Alex and Tucker? No?
I think just the last point. So we do have 3 breakout rooms scheduled to take us till 7. We want to be respectful of everybody's times. If you are interested in staying and meeting more people beyond those 3 rooms, just stay on the call and we can maybe throw in like an extra breakout room if you are interested in that. But there's absolutely no pressure. It's just to facilitate you meeting more people who could become your potential teammates.
If you guys also have any difficulty